This is the knee joint, which is formed by the lower condyles of the femur, the patella, and the upper crest of the tibial tuberosity. Now, as I told you, you can put your ipsilateral hand and you'll find all the points. The stomach is there on the either side of the patella, ligamentum patellae, and the spleen 10 is an anti-allergic point, also bleeding. Next, we come to the ankle joint. The ankle joint is formed by the lower half of the tibia and the fibula and the talus bone. And what is the relevance of the stomach, of the ankle point? You have the stomach 41 point, and there's the midpoint of the ankle crease. If you feel the ankle crease, both the malleoli, the tibial and the fibula, and the midpoint is the stomach 41 point. This is a picture of the hand, which I showed you earlier. I showed you the foot. Now this is the hand. As you know, there are 8 carpal bones, 5 metacarpal bones, and 14 phalanges. But what is the relevance of the hand to us? The important points there are H8, heart 8, and pericardium 7. How do you locate the heart 8? You ask the patient to flex his fingers, and just where the ring and the little finger touch on the palmar crease, midpoint of that is the heart 8 point. And of course, P7, this is the wrist crease, the distal wrist crease. The midpoint of that is P7. The foot, as I said, is one less tarsal bone. Otherwise, the phalanges and the metatarsals are the same. But it's important is, I told you earlier, what Li4 is to the hand, stomach 44 is to the lower limb. So just in the between the second web space is stomach 44.
And also, please remember, every case of slip disc, don't go and jump into treat. There are various stages and various degrees of slip disc. If the patient just comes to you saying, I got a pain of sciatica after walking, I get pain, this, that. You check his muscle power, reflex, everything is all right, fine. Some people will come screaming with pain. But again, if you find neurologically, I use the word neurologically, if they're fine, you can try that patient. But if you find that the patient is neurologically weak, what is first thing is known as a foot drop. You ask the patient to stand on the toes, and if they can't do it, and the foot falls down, that means that's called a foot drop. If they have weakness in the leg, and they say, I can't climb a step, please kindly refer to an orthopedic or a spine surgeon or a neurophysician for the safety of the patient. If they say it is fine, you can treat, only then attempt. Otherwise, this patient may need surgery to remove this obstruction from here. This is the side view of the vertebrae. You can see this normal vertebrae, the nerves coming. This is the disc which has burst here, and it is blocking the nerve. This is the normal disc. So this is the top view, this is the side view. Now, quite often, patients will come to you and say, Doc, I've got a pain here going into my hand. Or there's a tingling here, here, here. Or they may have weakness of any of these 5 fingers. Some patient may come with pain in the scapular area and saying, I got severe pain here. Now, other patient may come with pain in the front of the chest, especially. So instead of the right side, if you got a left side pain in going in the hand, you will be admitted in ICU for sure. And that is safer. If you got a heart attack, they can safeguard you. But when you have spondylosis or cervical slip disc, say, suddenly it gets plugged totally. So below 9th floor, you will not even get 1 drop of water. Or let us say you manage to try to remove, the plumber comes trying to remove the muck. He removes from the 9th floor, but it went and got stuck in flat 401. Only one. Now the whole building will get water till the bottom, but 401 will not get any water. So what do you mean? The level at which the blockage is there, the water doesn't flow. Same with the level at which the nerve is caught, the symptoms will go from that The symptoms will be pain, tingling, numbness, or even paralysis. That is why we have to understand the level of nerve root in the human spine and not just jump again. This is the beautiful anatomy of the human spine. Now we have got 24 vertebrae from cervical to lumbar. This vertebrae are divided as cervical, 7 vertebrae. You can see 1, 2, 3, 4, 5. These are called cervical. These are called thoracic, which are called 12 in number. Then we have got lumbar, which are 5 in number. And then we got 5 sacral bones, but these are all fused bones. Now this is the common thing again. Everybody's got a computer or a laptop, the desktop or and the keyboard on top. Now because of this, see, she's left her chair. There's a gap. Big gap. See, her neck has gone down again. She's going to get backache, 100%. So long hours, 6 hours, 8 hours, 10 hours like this, your neck and lumbar spine both will go. So to solve this, very simple, just buy a keyboard tray. See her chin now, see her back totally in line with the chair. Her shoulders are relaxed, her hand is relaxed straight on the keyboard. She can work for hours, there's no problem. A small keyboard solves a lot of your problems. Yeah, your number of cases will definitely reduce. So don't worry, but your credit will also increase. Now this is the way most of us lift an object. Now what is this? A plastic stool. So what are you going to say? But vajan nahi hai. But you forget that when you bend down, your load starts from the hip till your neck. So when you're getting up, you're lifting this load plus water is this load. Now let us say she's 60 kilo. When 10 kilos are for leg, but this is 40 kilo. But where is the focus? Just half a kilo plastic. No, this is 40 plus half. Your back is bound to get damaged. Your muscles are bound to strain. So how do you lift it? Now this is the diagram, which you will also agree with me are in our medical books. Unfortunately, the wrong people are doing the wrong job. This is an engineering job done by doctors. So we are taught this, but I have disproved that this is a totally wrong posture. When you sit down like this, you can see her knees are bent. Now let's say she's overweight, her knees are weak. How will she get up? So first she'll try to balance her body like that. She's balancing the body. And then she's trying to get up and back goes off. Instead, what have you done? She goes on one knee. Now what happens? When she goes one knee, this is the base. So it's like a base of a triangle. See the stability?